Good morning. What's the single most important thing for the public in this whole Pharmacare discussion? Affordability? Access? Guess again. Two-thirds of the public are afraid of how politics is undermining healthcare, and with good reason. With our fractured governance, who wouldn't wonder how Pharmacare actually gets implemented? And is it any wonder Canadians have little faith in the healthcare system? But what does the public really think? Basically, that everybody is a liar, and that includes the media. But why would anybody think that? After all, there's no concern at the top. Still, Ontario prevents the publication of data so bad it would be economically damaging. But the data comes out anyways, and it is brutal. But no, the health ministry says docs just aren't working as hard as they used to. Meanwhile, the province ships patients off to the gulag to be warehoused against their will. And sure, you can get the new lung, but there's the upcharges, the surcharges, and of course the denials. Now, you should notice that CEOs are the most distrusted of all leaders, and lots of actors are ready to take them on. It doesn't matter what the truth is anymore. After claiming that lower prices will inhibit innovation, CEOs spent $2.3 trillion on acquisitions, and these are just the deals over $10 billion. Keep claiming that high prices are only to invest in R&D. But why is there so much effort put into blocking access? And then the ridiculous fear-mongering headlines. Trust me, no one's buying it. Hey, private payers, I haven't forgotten about you. From step therapies to AI denials and forcing people to forego relationships that underpin good health outcomes, the public knows who you are. But who are these shadowy figures playing havoc with people's lives? Some people think private enterprise is the solution. Even the US is wondering. And what are those private clinics not telling you? While politicians and CEOs play games with people's lives, people die in the ER without accountability. And people are getting squeezed from both ends. The burden on families escalating every day. So what might people do in the face of high prices, denied coverage, and dying in the ERs? Anyone who's been to Disney World knows it's a small world. Hep C, head to the Red Sea. It's cheaper to move to Australia for CF patients. And can't travel? Use mail order direct from India and save 97%. But when people get angry, I mean really angry, and they're living in rogue, corrupt states, watch out. If you don't think compulsory licensing is a threat, then you probably haven't heard of the global health equity movement. So how do our leaders in Canada listen to patients? When the PMPRB was considering new guidelines, patient charities made their views public. That's what's supposed to happen when you have public consultations. What does the PMPRB do? They put together a $50,000 communications plan to smear these groups, claiming they're spreading misinformation. That CEO flamed out of the PMPRB, but reemerges as CEO of PCPA. How tone deaf is our leadership? Even academics publish shoddy research to smear patients. So it was left up to us. Our report, The State of Patient Associations in Canada, analyzed real data from the CRA and discovered that the single biggest funder of patient charities is provincial governments. That's right, the public payers. So if there's any bias from charities, it's to be friendly to the provinces. And here's the proof. Only $5 million out of $1.4 billion in total revenue is spent on public policy. It's not pharma that charities are beholden to. So are we just going to keep thinking like this? Luckily, Edelman's got a plan. It rejects the typical transactional approach to one that's interactional instead. Note that listening is the number one trust builder. Did you know that the number one complaint from patients is, nobody listens to me? Who should we listen to? A patient-led survey of patient support programs shows enrollees are predominantly in the 18 to 39 group. This means a lifetime of medication needs, a lifetime of costs and burdens on young people. Wrap your head around that when you're 20 years old, and I'll bet you thought they all had gold-plated benefits packages. Now, in case you didn't get the memo, patients and citizens are being involved in drug development and policy decisions around the globe. Earlier, I showed how our patient charities just don't have the capacity to be involved, and there is systemic bias against patients. What can we do here in Canada to catch up with what's happening globally? Recently, the Canada Drug Agency's own patient advisor issued a report on patient and public involvement and recommended establishing a new patient organization that can be a legitimate partner in drug policy dialogues. After all, Ireland has one, Spain has one, mighty Australia has one, the EU has one, and even Bulgaria has one. Other countries have one. It's time to recognize that it is just morally wrong not having one in Canada as part of the Pharmacare discussion. Edelman's message to business and government is clear. Act in the interest of the public good to restore trust. Otherwise, don't be surprised if Elvis shows up in the room with an offer for semaglutide that I just can't refuse. Thanks very much for your time.